My name is Jessie Higgins, and I'm the Chief Mental Health Officer for the City of San Antonio, and I've also had the privilege of being on the planning committee for this conference. And so I just, again, want to thank you all. This is a group of people that I deeply admire. They're fun, they're friendly, they're passionate, they're smart, and they want to put it all out there for you so that you can understand what we mean when we talk about recovery and how we can work to make San Antonio a community where all people who are in recovery feel comfortable, feel included, and are able to have as much fun as the rest of us. And so it's just really wonderful to be here today with you all. If you have CEUs, if you were here yesterday, you know the deal, turn in your form at the end. And with that said, I'll go ahead and introduce our panel. Jennifer Sharp Potter is a PhD and a master's in public health. She's the vice president for research and professor of psychiatry and behavioral sciences at UT Health San Antonio. In 2008, Dr. Potter joined UT Health San Antonio from Harvard Medical School and McLean Hospital, where she completed her pre-doctoral clinical internship and research fellowship at Harvard Medical School and McLean Hospital. She received her doctorate in clinical psychology at the University of Georgia and her master of public health from Emory University. Her expertise is in prevention and treatment of substance use disorders, chronic pain, dissemination and implementation of evidence-based practice, population health, and clinical trials. Christina Varela-Mayer is the CEO of Blue Heron Recovery. She was awarded her doctorate in psychology from the School of Behavioral Health Sciences at North Central University. She earned her Master of Arts in Behavioral Science at the College of Human Science and Humanities at the University of Houston Clear Lake. And she received her undergraduate Bachelor of Arts degree in Political Science and Speech Communications at Baylor University. She is a published author and lecturer, and in 2015, her Dissertation of the Year nominee, and is credentialed with the Texas State Board of Examiners of Psychologists and the Texas Certification Board of Addiction Professionals as a licensed chemical dependency counselor. Her research endeavors include the study of post-traumatic stress disorder symptoms of depression and somaticization as moderators to academic self-concept theory. I don't know what that means, you're gonna have to tell me later. Stigma and barriers to care among Army combat medics, and pre-existing risk and enhancing protective factors of Army soldier medics during training. The Reverend Justin Allen Lindstrom is the Associate Rector for Community Formation at Christ Episcopal Church in San Antonio. In this role, Justin oversees the children, youth, college, and young adult ministries of the church and serves as the Director of all outreach. Christ Church is a thriving and growing congregation in the historic region of Monte Vista, and Justin has served as the Dean of St. Paul's Cathedral in Oklahoma City, was the founding vicar of St. Aidan's Episcopal Church in Cypress, Texas, and was the Associate for Youth and Family Ministry for St. Martin's Episcopal Church in Houston. He has been ordained for 24 years. So as we transition into this topic where we're talking about building a community of recovery, I wanted to ask our panelists what their definition of recovery is so that we could set the stage. So we'll let y'all jump in, play nice on the playground. Who wants to start?
Well, I probably have the worst answer, so I'll go first.
Go for it.
I'm not Jennifer Potter. It's really nice to be here, and I was just talking with someone in the green room. I have to do this very brief preamble, who introduced themselves first as a mom. So I will just say hello. I'm also a mom first, and all those other things second. I mention that because recovery for me in the definition, if I take off my science hat, there's a formal definition, but I guess today, I will say that recovery means, in many senses, whatever that means to the person who is on that journey or is experiencing recovery. And what I mean by that is the definition of recovery really has to come from that person, where they are at that time in their lives, what their challenges are, what their contexts are. And I will say recovery is not, for me, always what I think is the stereotype of somebody whose life has gone from struggle to perfection, to a state of perfect bliss. It's that moment of digging into the well of life and the struggles, but also realizing there's a sense of purpose in all of that. And so quite concretely what that means is I don't see it as something that involves complete abstinence. I come from the world of substance use, so I'll talk about it in that frame. It's not a perfection where somebody never uses, where life is just going on. And so I think I'm happy to talk more in the conversation about what I mean by that. But that's what recovery means for me today.
I'm Christina Mayer, and to piggyback on that, I hear you. And similarly, I think recovery really is discovery. When we're talking with folks who come in for treatment, we not only talk about what are you using and what are your struggles and what's going on right now, but we also talk about anxiety and depression, attachment disorders, and stress and trauma and all of those things. And let's discover what are the things we can do to address the real underlying issues. So there's a lot of discovery that goes on in trying to figure out how to address challenges and move forward.
Wow.
Maybe if y'all could hold the mics, I think people are having a hard time hearing.
Yeah.
Everyone's so gentle this morning. It's really nice, but yeah, hold the mics.
We didn't know if we had permission to grab the mic. We're taking the mics.
Go for it.
Squeal.
That's much better.
There we go. All right. So I'm Justin, and I'm a husband and dad first, and foremost. So it's good blessing in all those realms. Love y'all's answers, and I would just say, to add to that, I would say that recovery is not a destination; it's a journey. That we are constantly recovering from all aspects of our life in some form or fashion, and those challenges that come around. And I would say personally for me that it's been realizing that I'm trying to phrase it in a way that we'd all get it. Recovery has been realizing that I'm not perfect and I don't have to be, that I'm allowed to make mistakes and to identify those, and then have a good network of support to help identify those mistakes and to move forward from them. And that's been just a profound blessing in my own life. And so that's what it would be for me.
Thanks. All right, I'm going to hand it over to you, Jennifer, if you want to talk about your program.
Okay.
You don't need a mic, Justin.
I don't need a mic. I just took the mic.
All right.
You can have it. So I have about 10 minutes, right? Okay. Well, I thought it was great that Jessie was mentioning passion. Normally, I'm a very excitable person, and we'll see if we get there today. But last night, I was at a football game. We're partnering with Dave Campbell's Texas Football to go around and acknowledge deserving unsung heroes, in this case, football coaches, that work in communities and really go the extra mile to support. So I'm a little more subdued because I was that late at a football game. The purpose of that was to talk a bit about fentanyl and point out that right now in the United States we have a very dangerous situation with substances because we have in the illicit drug supply a substance called fentanyl. This is not the fentanyl that's prescribed by a healthcare provider. It's illicit fentanyl, often brought into the country, and unfortunately it is extremely potent and it is extremely deadly. There have been some articles, there was a lovely one in the New York Times recently that this is not our grandma's drugs, I think was the title. And so I always say that at the beginning of a talk, because right now, if you have somebody in your life or are using substances, it's just really important to understand just how dangerous it is. And this includes people who may not realize that they are being exposed to fentanyl, and the consequences can be deadly. And a mom last night came up and mentioned that she'd lost a niece to this, and said, isn't it interesting how we know so much more after something happens than before? So that's my little public health message to y'all, since I have a microphone in front of me. And if anyone has personal experience or would like to acknowledge someone on August 31st, it is International Overdose Awareness Day, and there'll be a small event at Be Well, Texas, and I'll tell you what the heck that is in a minute. And the San Antonio Council on Alcohol and Drug Awareness are hosting. It's a very quiet acknowledgement. We'll also be handing out something called naloxone. Does anyone know what naloxone is? fabulous. I'm hoping that some who didn't raise their hands just didn't do that because it was on Saturday morning, but I will tell you that there is a life-saving medication that is available over the counter or free. We'll be handing out some there. It's important if you have opioids in your life, whether that's a prescription or whether there's someone who's using opioids, critical to have this life-saving reversal agent to prevent an overdose. And so we'll be handing out some naloxone on Overdose Day, and I honestly don't think I put it in the slides, but if you're interested, it's overdoseday.com, and just search for the San Antonio event. Okay, so I, in 2018, had the opportunity, I got the phone call that if someone like me who cares a lot about people who use drugs and substances and believes that it is a treatable condition, when people are afforded the opportunity to have treatment that works, got a phone call that I could not believe, where I had an opportunity to partner with Texas Health and Human Services to expand access to compassionate, evidence-based treatment for people who use drugs and alcohol. And for me, I used to be an actor many, many years ago. I described it as I never got a chance to serve in the field of acting in the way that I'd envisioned when I was probably 14 or 15. Didn't make a movie, wasn't on Broadway, but in the profession that I chose, which is clinical psychology and working with people and seeing them on their pathway to their goals in life and treating people with substance use disorder. When you get a call to help the state run something and you believe there are models and approaches that would allow us to do a heck of a lot better job than we do right now in Texas, you can't turn it down. And so that's Be Well, Texas. So I'm gonna move here because I feel like I got that stage there. So that's Be Well, Texas. And Be Well, Texas is the name of a couple things. If you insist. Be Well, I told you I get that mic somehow. Remember, I used to be an actor. See, I'm revving up now, so look out. I've had my morning coffee. So Be Well, Texas was my name to describe a program that involves a whole lot of other people, including a lot of programs in San Antonio and throughout the state. So I want to tell you a little bit about it, but I'll tell you up front, I've already said a couple words about it. I believe in compassion. In 2018, I organized my thoughts around a little TED Talk that I did here in San Antonio, and I've been saying the same thing ever since. I'm a bit of a broken record about it, but compassion for me is more than feeling sorry for someone or feeling bad about it. It's taking the courageous step to actually do something. And so I applaud everyone in this room because I know just by virtue of the fact, whether you're in the profession, whether you're a parent, whether you're a loved one, whether you're curious, whether it's just something to do on a Saturday morning, the very act of you being here is compassion because we do something. And that is what I think is essential when we're dealing with mental health and substance use disorders. The other pieces, all that gobbledygook in my introduction was I was trained in a scientific method, and I believe that if we actually want to have the greatest impact, we can celebrate individual journeys, but we need to understand how to maximize our interventions or our treatments or the work that we do for the most people in the population. And I do that through science. So you heard a little bit there, I would do controlled clinical trials, and those are the gold standard for developing treatments. It's what we do for cancer, it's what we do for diabetes, and it is what people who have mental health and substance use disorders deserve for their treatments as well, is approaching this with the very best science that we can possibly have to develop the medication treatments as well as the behavioral treatments that are proven in a population to have the greatest likelihood of reducing morbidity and mortality, because make no mistake, as many people in this room know, that is, these are life-threatening conditions. And too often people forget that, and it's just so important that we think that way. So that's my bias and my perspective. I also believe that local matters and community context matters, and we'll talk a little bit about our program. So this is compassionate evidence-based treatment, best we can do, and services in Bexar County and throughout Texas. We're based at UT Health San Antonio, but we deliberately talk about Be Well, Texas more than we do my university, because at the end of the day, my university isn't really that important in this, and I say that as a vice president. It's about the community that we're wanting to form and the capacity that we support building to elevate the programs in our communities, fill gaps where they exist, and advocate for adequate resources and evidence-based practice. So this is how we do this. I'm going to start with the easiest part for me because it's my roots, which is the clinical research. In Texas, there is a dearth of access to cutting-edge treatments for mental health and substance use disorder. It is very important, just like in cancer, there's a reason why we have all those clinical trials at cancer programs, because when the current treatments don't work, we shouldn't be at the edge of a cliff. We should understand what we can do to offer people cutting-edge treatments. So the backbone of what we do is our clinical research. That's a small piece, actually, of what we do, because it turns out there actually aren't that many great treatments in the pipeline. And that's a policy issue in the United States, that we don't have as many options like we do for other diseases that we see in the United States. So clinical research gives us the opportunity to provide access to cutting-edge things that people might not otherwise have. So for example, right now we're testing, or have just finished, 3 medications that have never been tested before for stimulant use disorder. That's cocaine and methamphetamine, and if you know anything about that, you know that those are very hard to treat, and there are no medication-based alternatives for folks. So enough about that. We also have some great programs, and we're recruiting for marijuana studies right now, so if anyone is interested, I'm happy to tell you about those offline. But the backbone of what we do is these other 3 programs. We have a Center for Telementoring and Training. Our workforce needs access to no-cost, high-quality mentoring, case consultation, and continuing education, and those continue to be challenges. We have to make sure that the workforce is contemporary and understands the very best practices. So this is one of the things that we do. You all may know there's a lot of turnover, so we invest dollars in training folks, and for a lot of different reasons, salaries, burnout, the challenges, we see these things, and so mentoring programs and supporting people using Zoom and other activities like that is a really important piece. I think of this as the least funded work that we do, but arguably the most important, because I would like to put me out of business and my team, because if all of our communities have the talent there to do this, people like me don't need to exist, right? We need this work there. We also have a provider network. We have sites throughout the entire state of Texas. We have a lot of them in Bexar County, because it turns out, unfortunately, Bexar County is notably higher in a lot of substance use disorder, methamphetamine, cocaine, opioids, marijuana, and alcohol. And so a lot of our programs are here, right here in San Antonio, and I'm happy to tell you about those. And then the last thing we have is what is my baby, which is our Be Well Texas Clinic. This is a virtual clinic. Right now, for individuals who, let's say sometimes life is hard and life is complicated, and if anyone's ever tried to make an appointment, even at UT Health San Antonio, sometimes that can take a long time. And I believe that the moment a person is ready to ask for support, that help should be available. I want to be as on demand as possible. I believe that many of these conversations occur to people at 2 and 3 and 4 in the morning when they're alone, and that's the right time. But our systems are designed in ways that make it so very hard to meet that person at right time, right place. And so this is our effort to do that. We're starting to go 24-hour. This has been a long process, but these are phones that are answered 24/7, and we can have people get this treatment in the privacy of their home if that's what they want. We can have these people seen by a boarded addiction medicine physician or a trained nurse practitioner right at their home. We can mail them their medications, and we can do all of their labs remotely as well. And this is a pretty unusual thing, and it's why this has been such a joy. It's been open about a year and a half. People can come and meet us. We love to have people come in person, but when life is complicated, when you don't have transportation, when you have all these things and the symptoms of what you're struggling with get in the way, when you watch that person who's tried so hard to do everything right, but didn't happen to be free at the time that the phones were being answered, that just seems wrong, because these people are working so hard. And I say that, remember I introduced myself as a mom. So how do we make it easier for people? Because too often our systems are the greatest challenge that a person will face when they are trying to navigate systems. And that is not acceptable. And so this is our beginning. We get it wrong every day. We're imperfect, but sometimes we get it right. And we can have somebody walk in and we can treat them in that moment, and they can walk out with a little bit more hope than perhaps they came in with, because we met them at that moment and started them on whatever treatment it is that they needed. Usually it doesn't work that way. So that's a little bit about Be Well Texas, and I'm going to leave you, I can't remember, I think I have another slide. I'm going to leave you with one other thing about it that I haven't mentioned. Because of a couple different reasons, I have and need to say thank you to everyone here, because the reason we can do this is because of all you and your tax dollars. Because what we offer, as you may know, Texas does not have Medicaid expansion, which makes it complicated sometimes to treat things because people don't have the dollars they need to pay for the care. And so these programs that I'm talking about, we can offer to people without the ability to pay. And to have the opportunity, and that's why this is that moment that I couldn't refuse, to have the moment of the opportunity to provide the same care that everyone on this podium would want, because I'm assuming we all have insurance, and to be able to offer care that we can have to people that don't have that access for whatever reason is an extraordinary opportunity that we should know exists, not just with us, but with a lot of different programs, but the challenge is getting the word out. So I'm so grateful to have the opportunity like this to continue to spread the word of what we're doing. We have a conference that we do. If you're interested, that's a little bit about it. And I'll end with, our motto is, welcome to Be Well Texas. We are so glad you're here, because stigma is toxic. We all carry it. We all have biases that we carry with us. I have biases. I make mistakes all the time about this. But when we put stigma ahead of the person and the fear that comes with that, that is one of the reasons people don't seek help, and I just can't emphasize that enough. And so our clinic answers the phone most of the time. Welcome to Be Well Texas. We are so glad you're here, and we mean that because we care so much that is a message and a value that we have. Because again, I just can't emphasize enough the toxicity, even when it's unintended, of the stigma that we all carry, and we have to be constantly vigilant about that. And I'll wrap it up with that. Thank you so much.
Hi, I'm Christina, and I am dual-hatted today. I am here to share a little bit about both Blue Heron Recovery and the Los Patios community. Los Patios has been around in San Antonio since the late 1960s. Are people familiar with it? And it's changed. In 2021, we became a sober community. And the idea is to reduce the stigma associated with sobriety in general. The hope is that Los Patios will continue to flourish and grow and become a place where everyone can come and hang out and have fun and enjoy their families and be together and do what we're doing here, sometimes for events, sometimes for discussions, in community. Addiction thrives in isolation, right? But recovery requires community. And I had a group of folks, my family included, and we were trying to figure out, where do you go in San Antonio that's sober? Like, where? And how do you celebrate Fiesta and all these fantastic traditions we have without tequila? It just doesn't happen. So do you stay home and isolate and do nothing? Or do you come out to Los Patios and have some fun? So we had our first sober Fiesta during Fiesta Week in 2021, and y'all, we had like 1,500 people there. It was great. Free and open to the public, and live music and bands and mariachis and pony rides and face painters. And we tried it just to see what would happen, and it worked. And I was telling Dr. Potter the other day that it was the coolest thing. A man walked up to me and said, man, if we'd have had this in the 80s, my dad and I would have had a different relationship, because we couldn't even go to SeaWorld. He was focused on the beer. And my memories with him were dad and beer, dad and beer. Can I be on your board? And now he's a member of the board, and it's really fun, and he shares his own perspective. And another family came up. They came in from Austin, and they had the most beautiful 14-year-old girl, and she was wearing flowers in her hair, and her face was painted from the face painting artist person. And Her parents said, she's 14, she's been sober 6 months. We live in Austin. We came for this event. And if you did this a lot, we'd move to San Antonio. Because we're fun, but we can be fun and sober too. So how do we normalize sobriety? Show kids that you can have a good time without alcohol being the center of everything. Come together with family members without Uncle Joe passing out. And so here we go. So we're new and we're started, but I think I'm supposed to do a slide. Yeah. So we're a collection of different communities within the sober property. We have 2 sober restaurants. One is called Naco. It's a Mexican restaurant that is fantastic. The other is Comfort Cafe. You may have heard of them. They support their facility in Smithville at the restaurant there at Los Patios, open on the weekends. We've got a yoga studio run by guys who are in recovery, so they get it. A dress shop and a jeweler and a medical clinic, and Gardopia Gardens is opening up a thing and doing weekends in the garden. The idea is you can come ride the trail that's right there on Salado Creek and come to the community and then have lunch with your friends and eat Mexican food and drink aguas frescas and not worry about anything else. And it helps normalize sobriety. Because sometimes you walk into a party and you're the only one who's a little bit left out because you don't have some fancy cocktail in your hand, and a lot of times there aren't even other choices. So our goal is over the coming years to build it up and make it fun and fabulous, and you forget that it's not normal, and we make it normal to have sober fun. Having said that, San Antonio Council on Alcohol and Drug Awareness is hosting on September 9th, free and open to the public, the Recovery Rally for San Antonio. And again, we will have pony rides and face painters and balloon artists and the petting zoo and all of the fun things. So bring your kids and bring your families, and don't worry about stigma or tequila to get in the way of having a good time, and teach kids that we can do that. I'm clicking through a few shots of Los Patios, so if you haven't been there or you haven't been in a while, you can remember what it looks like. We have baby deer. I'm telling you, this place. That little baby deer, he's one of 2. The mama dropped 2 this summer. Purposefully, we created Los Patios. I worked previously at a residential place right outside San Antonio that was fantastic. People come to residential treatment to spend 30, 45, sometimes even 60 days away from life. And they're in the bubble, and it is rainbows and unicorns, and here's your breakfast, your massages at 2, and we're bringing the puppies for puppy therapy at 4, and it's great. Who wouldn't be happy there? And then you come home. And you come home to Bernie or San Antonio or New Braunfels or wherever you live, back with wherever you live, whether it's your family or your best friend or your dog, and your neighbor's dog barks all night long. And you get in a fender bender at HEB, and you argue with somebody you care about, and there's no therapist there with a puppy to swoop you up and have you feeling better. So what do? Do you isolate? Do you find your community? Are you in a program? Are you not in a program? Do people really get it and understand it? I don't know. So we purposefully, as part of the Los Patios community, opened an outpatient treatment center that feels like residential. We don't have a lot of puppies. Every now and then somebody will bring one, but we have the deer and the red-shouldered hawk and the most beautiful buzzard family you've ever seen. They have these little baby buzzards with fluffy hair, and they come every spring. So when you're there, even though it's just for the day before you go home, you get to see that little baby deer, and you get to see the hawks and the buzzards and sometimes the snakes, depending on the season. And it's fabulous, so that when you go home at the end of the day and things aren't perfect, you're still engaged with treatment. And to piggyback on what she was saying about research-based treatment and evidence-based modalities, we strive to use those because science moves us forward. So the goal is for people to learn the discovery and figure out what's been missing and learn new ways and stay connected to a sober community that's big and keeps growing, connections and getting
community. Oh, yeah, okay. So we had Fiesta, and we had the Spasmatics, and we try to make it really fun. And the Spasmatics was actually the first event we had. We had it before First Fiesta. And I can't tell you how many people were like, I'm going to remember this concert tomorrow. It's hard to get used to that. It really is, but they did. And these are the companies that are there, Naco and Blue Heron and Terra Design, their landscape folks, Gardopia Gardens, the Med Clinic, Comfort Cafe, Pure Prana Path. We're hoping to bring on another restaurant and maybe even a sober bar. We were talking with somebody about taking that old bar over in the gazebo and having some music, and so you can go and have an evening out and not close it down at 6:30. Oh, okay. Well, I guess that's my cue. So y'all keep an eye on Los Patios and come on out and visit us and enjoy the community and reduce the stigma. Thank you for being here today.
It is so fun to be a part of this, and such a great opportunity. I just celebrated my 5th anniversary at Christ Episcopal Church, and I can honestly say that it's been the opportunity of a lifetime to serve at Christ Church. And I'll get to share some of the things that we're doing here that just make it so, and it's just fabulous. So we have the Peggy Mays School Support Ministry. Peggy was a member of our congregation. You may not know the Mays family, but they owned Clear Channel and sold that many years ago, or a few years ago, and very wealthy family, and they support our school ministry. And I've never been a part of a church that's adopted 4 schools. 2 elementary schools that feed into a middle school, and then that feed into Jefferson High School. So Madison and Maverick Elementary, and Longfellow Middle, and Jefferson High School. And we've been a part of Madison Elementary for about 12 years, and the other 3 for the last 4.5, 5 years. And one of the things that we love about working with our students and the families is that we build relationships in a way that we do get to hear about what's going on in the family life. And substance abuse and use is very prominent. And I can't tell you how many of our students live with grandparents, aunts, uncles, because parents are incarcerated because of substance use, and the potential of crime that comes with that and other things. And so it's just been an incredible opportunity to build those relationships and to then connect people to resources like you've heard about. And so part of the reason why I wanted to be a part of this panel was to help people understand that there are many layers of all of this that need to work together, and being better together is important, because that's the theme of our conference, but also because it is what works, right? And so we are almost kind of like front line, if you will, when we're handing out food, or we're handing out socks or underwear, or we're paying for someone's rent because their house burned down, or paying a utility bill. We meet the families that we serve, and we get to sit and chat and figure out what else is going on, and we build that trust. And so it's been absolutely an amazing opportunity. This year, Jefferson High School students came to St. Paul's Roman Catholic Church and Christ Episcopal Church, Roman Catholic and Episcopal together. And they said, the students said, we want to have a baccalaureate service. And so together, that's the picture on the far right, the Roman Catholic priest and myself, he and I held a baccalaureate service. And every student that came, they came down with their family, and they knelt down and we prayed over them. I kid you not, every father that was there was crying. And I got to talk to some of them, and the stories that they shared about their kids and about their life were horrific, but then also victorious. because they had the community surrounding them, they were able to build a life of recovery, build a life of renewal, and the tears for many of the dads were tears that they could actually be there and remember that prayer. It was just absolutely amazing. This year too, the picture in the middle at the lower part, we had our first back to school bash. We had almost 200 families show up, and we provided clothing and brand new socks, as well as school supplies and food for a couple weeks for every family that came through. And as they came through, they were greeted by the priest of the St. Paul's Roman Catholic Church, myself, and we started to build relationships to kick off this new school year. It's all about getting to know people and building those relationships. And many of the folks that we work with do not have a support system. They're alone. They might have grandmother and 8 grandchildren, and that's it. And the grandmother struggles to take care of the 8 children, and we come alongside and say, we're here to walk the road with you and be companions along the way. And it's a powerful experience. Another thing that we do is called Sidewalk Saturday, and every Saturday morning for 27 years now, we've had a food pantry, and 4.5 years ago, we decided that we wanted to expand that and to really get to know people instead of it just being transactional of us handing a bag of food to a family, that we'd actually get to know folks. And so we expanded to a clothing closet and toiletries, a prayer team, and began to really get to know folks. And we did away with handing out numbers to people and calling people just by numbers, and we put name tags on and began to try to get as many of our parishioners there so that we would have a 1-to-1 or 2-to-1 ratio of people coming to the people that were there to serve, so that we could sit down and converse with one another. We began to make homemade breakfast tacos and serve hot coffee. Even in the middle of a hot summer, hot coffee is always welcome. And so we began to sit together and build those relationships. And we finally got to the place where we thought we needed to provide more fresh foods, which we weren't able to receive with our contract with the food bank. And so we went to Daily Bread Ministries and picked up food, fresh fruits and vegetables, as well as milk and juice and bread and that kind of thing. And we realized that with Daily Bread, we didn't have to create a bag that has the same thing in it for every person, which you have to do with the food bank because of federal government regulations. And we're fine with that. But with Daily Bread, we were able to put the food out on tables and let people choose. I kid you not, it was 2 weeks after we started doing that people came to us and began to share what was going on in their life, because we gave them dignity and respect by allowing them to choose. I began to think about that, and I thought about what poverty looks like, and it's about the lack of relationships for me, I think, and with those lack of relationships, we then have a hard time if money is short in making rent because we have nowhere to turn. So we turn to the different systems in our city and in our county, and those are great to have them there, but a lot of times there's not a choice in those things. It's like, if you want us to help you with your rent, you need to move to this place or do this kind of thing. And so they're basically pushed and told where to go and what to do. And that for some is easy, and for others it's very, very difficult. It was a few weeks after that we started hearing these stories that people also said, we would love to worship together. I'm like, that would be awesome. As a priest in the church, I was like, wow, that would be so great. And then I thought to myself, how do you do that with federal funded food bank food coming to us? So we started handing out numbers again, but not because we wanted people to be a number, but because we wanted them to be able to save their place in line and pull out of line and come and worship with us, and then enter back into line where they were. And still they would receive a name tag when they checked in, and we would take the number from them. We've been worshiping for over a year now. We've had weddings at the worship service. We have had baptisms at the worship service. We've had a funeral at the worship service. And it's been a powerful experience. And it's through that worship and through those relationships that we have come to learn the layers upon layers of struggle and challenge that many people face within our community. And we've been able to connect them to resources like you've heard in the first two presentations in our city and in our county. And so that's been a neat opportunity. Let's see here. All of that is important because I was here in San Antonio on January 15th, 1995. I was in seminary, and I walked into where our retreat was after a night of drinking, totally smashed. And a good friend of mine who was the professor of the class that I was in, called Youth Ministry in a Cross-Cultural Setting, said, "What have you been up to?" And I said, "I've been doing youth ministry in a cross-cultural setting," in a snippet way. And he said, "I don't think so." He said, "Both of my parents are alcoholics." And he said these words to me. He said, "You will be a good pastor, but you won't be great until you realize you have a problem with alcohol." On that day was the last day that I took a drink. Now, it was a difficult process to get there because I was in seminary in Austin, and in 1995, all of the AA groups in Austin were, they were not smoke-free. So I went to a couple AA groups and just about choked to death with all the smoke that was going on in these tight rooms. I discovered I was allergic to smoke, and that the AA groups wouldn't be a process for me. And luckily, the insurance I had and the community around me allowed me to get personal therapy and counseling. It was shortly after that that I met my wife, Susan. You see in the middle there. And after that was ordained a priest in the Episcopal Church. None of which would have happened if I had kept drinking. I stand here today with my son, who got married this summer. And it's amazing, absolutely amazing. The beautiful thing is I serve a church that is an alcohol-free campus. And it was that way before I got there. And it restrains us a little bit from doing some things. When we have weddings, the receptions are never at Christ Church. There's not been a one. But it also gives us an opportunity to host AA groups and NA groups and other things in a campus that is committed to being alcohol-free. And people feel comfortable and welcome because of that. Our AA leader has been leading the AA group at our church on Sunday evenings for 44 years. 44 years. So it's a part of who we are and a part of the community around us. And so I come today to celebrate that and to thank you for being here and for us to realize that all the different layers of how we can work with one another, from our church communities, from our school communities, to the clinicians, to the therapists, to the AA and NA groups and other 12-step programs, but also from our hospital systems, through the whole gamut of all the resources that are available, that we work together and we become companions along the way, so that folks do not feel alone and isolated, but connected to what is available for them. Thank you.
I told y'all they are great. Thank you, each of you, for sharing and for telling us about your passion and the work that you're doing. I always think about work, how it takes up most of my time and will probably occupy most of my life, and it should be meaningful and it should be shared with excellent collaborators who co-labor in the space. And thank you again, each one of you. So we're going to do some questions with the panel, and this session is meant to end at 11:45, and so towards the end we'll have some time for you guys to talk amongst yourself also. We want to make sure that you're hearing us connect, but you're also connecting with each other. And so for our first question, how does community factor into recovery? I think you guys answered it pretty well, but if anyone wants to add, or if someone sparked something in your mind, I'd love to hear if you have anything else.
I always talk, so jump in, folks. So I think what's really important in this is, in many ways, this seems patently obvious, right? But in my heralding of science, I will also say that there's actually evidence about this. And so we know there's a preponderance of evidence that demonstrates with rigorous studies that the social connection that comes along with community is incredibly effective. And I believe that is one of the reasons why, and the science would back me up on this, that AA is so profoundly important. It's why these mutual support groups are incredibly important in terms of creating social fabric and structure for people. Humans are inherently social creatures, and when they live in isolation, it is, you can never say everything for everyone, but generally speaking, that isolation, and you've heard that from us multiple times here, does increase risk. And that's both for mental health and well-being, as well as for substance use or a relapse from a recovery. So it's just really important to understand that. It's also an important warning sign. The other piece of it that I think is important is that these are not situations that are solved by individuals and families. It is by a network and a fabric of care and local solutions to understanding how to help people, because it is complicated and this is hard. Beginning or maintaining a journey of recovery from addiction is one of the hardest things we can ask people to do. And we ask people to do this from the depths of an addiction. And I always try to look internally and understand, could I do what I am asking somebody else to do? And honestly, I don't know the answer to that. And I won't know the answer until I'm in that situation. So community is essential to be able to help and support and lift people up.
Reverend Marsh this morning from the Episcopal Church in Uvalde talked about community bringing us together, but also community requiring us to be vulnerable and mutual, and a lot of times that brings tension or conflict. I think he said we're better together until we're not. And so I'm wondering if you guys have experienced any pushback in your work. Maybe in the work you're doing, oh, that's cute. They're all like, maybe, yeah. Maybe in the work you're doing right now, maybe in previous work that's led you up to here. And if you feel comfortable sharing, name names or don't, we're here for all of it, so.
I'll jump in. The Episcopal Church has been known as Episcopalians. I don't know if you've ever heard that, but whether there's 2 or 3 Episcopalians, there's always a 5th, and so pretty heavy drinkers, and we're trying to counter that.
I just got it.
You just got it? Yeah, good. All right. I think they all did, but yeah. So. So probably about 8 years ago, we had a newly elected bishop at her consecration party drive home drunk and hit a bicyclist and killed him. And that was the wake-up call to our church that we needed to do something differently. And so we get a lot of pushback for being a non-alcoholic campus, non-alcohol consuming campus. And But we stand firm in that, just because we want it to be a safe place for everyone, and a place where people can come and feel welcome. And so that's been hard for some of us and easy for others in our community. But our lead pastor has been committed to that, and our board, called the vestry, is committed to that every year as well. And so we keep pushing back at it. And, why do we have to have, wine at a funeral reception, right? And people go, oh, yeah, maybe we don't. So, when you start putting it in those terms, that's the way we've been able to counter that. But it's there's a lot of pushback on it, and we try to fend that off as best we can.
I love that. And we get pushback at Los Patios too, but I want to tell you this story. It's fantastic. We get so used to expecting alcohol to be everywhere, expecting you walk past the park and it's going to smell like weed. We get so used to expecting this that when it's not there, it sort of startles us almost. But I have to tell you a quick, short story. It takes practice. We had the most amazing patient in outpatient, and he was there for months. He came in and said, I'm only going to do this the minimum 28 days, and then I'm out. And now we're like at day 92, and he's still there. And he walked in one day and said, because he wanted to be, not because he had to be, he walked in one day and said, damn it, Blue Heron. And I said, what happened? And he explained that growing up in his family, whenever the family got together for anything, Sunday barbecue, it didn't matter what it was, lots of drugs and lots of alcohol. That's just what they did. And he married a woman whose family didn't drink and didn't use anything, and he didn't enjoy hanging out with her family because he thought they were boring and weird. Well, one of the things we do when we have sober campuses is play sober games. We have a pool table, we play cornhole, we do Jenga, silly things, just to get used to practicing being together, communicating, hanging out together without using or drinking. He walked in to Blue Heron just to tell me I played cornhole with my in-laws, and I didn't even realize that we weren't drinking or using. I had so much fun. I was the cornhole champion, and then I realized, oh, this would have never happened a year ago. And so the practice really does make a difference. All right, that's my story. That's all I got.
That's nice.
So I'm going to jump in, and I'm a little uncomfortable that I'm in the middle when I do this. So I experience pushback in a lot of different ways. I've had, and I'll get to why that is, a leader at my own institution say, I don't want those people in my program. So providers also carry with them stigma, and it's important to understand that. It's okay to not work with a provider who makes you feel small. And the only person who knows that is probably that person, but that therapeutic relationship is important. But the reason I said I'm a little uncomfortable that I'm in the middle is I will say that when I said that I started with recovery as whatever it means to that person in that moment, and they weigh that, I also mean that it is not necessary from my perspective and some of the work that we do to maintain a sobriety as in abstinence only. And I appreciate that that's different from different people, but you might notice I was working pretty hard not to use words like sober. It's not because I have a problem with those words, but I don't use them because different people have different perspectives. So and those perspectives are valid too. So if somebody who has had a chronic opioid exposure and has an opioid use disorder and is in treatment for that and remission for that, being managed by an evidence-based treatment, and they choose to continue to use marijuana, that's their choice. And for that individual, they may be in recovery. And I would support that from a harm reduction perspective, because while marijuana can cause many people dysfunction, it is generally speaking safer than chronic opioid use that's uncontrolled and unmanaged. And so I guess what I'm pointing out for those of us in the room that may not be thinking about sobriety as part of the solution, or may have a family member or someone they're working with that's not ready for that, or doesn't want that, that's also, from my perspective, okay. And again, I'll go back to my science and the literature, and the evidence suggests that it's important for people to meet people where they're at and understand that there's value in reducing risk. It's not an all or none for some people. It is, for some people, that moment where worlds collide and a choice is made and a new destination goes. But for some people, it's messier than that, and that's okay too. We're working to try and reduce adverse consequences and improve quality of life. So I just wanted to mention that, because that's a pushback that we get a lot, because our culture supports abstinence only, and that does leave some people behind, and they feel excluded from recovery, and I just wanted to mention that.
Absolutely, I agree.
Medically assisted treatments too, to be able to reduce the stigma with that. Everyone's in a different place and heading a different direction. So whatever we can do to ease the transition to getting wherever it is you want to be.
Yeah,
So,
and you.
yeah, I agree completely.
For sure.
Absolutely,
Yeah.
no, it's.
And I totally agree too. For me, abstinence is what is necessary for me in my journey. If I'd have one drink, I'd have 20, and I know that now. And so, but totally understand the perspective, you know, the continuum of care and where that is and all of that. So that's great.
It's always my second favorite question. My first favorite question is next, so get ready. What's the best part of your jobs?
Yeah, I want to go.
Okay, so you know how nobody gets excited about group therapy because no one wants to talk to a room of strangers? I mean, except for us, obviously. I know I do too. Group therapy is my favorite part of the job, and I don't get to do it very often anymore, but people will come to treatment and they're like, you know what, I just need a counselor once a week, I'm good. I don't want to go into a room with a bunch of people I don't know. I'm like, okay, here we go. Your first group is at 9. And it's the most amazing thing because people will walk in and say, I have nothing in common with whoever's over there, because we'll have a 75-year-old grandma sitting next to a 23-year-old dude sitting. I mean, like, everyone is so completely different, and their substance of choice is different, and their story is different, and their experiences are different, and we'll only have 7 or 8 in a room, and you could not imagine 7 or 8 more different people. And it is so phenomenal to watch what happens when people start talking and the most unlikely friendships occur, because we all realize that everyone's just human, and at the end of the day, we really are experiencing the same things. Stress and anxiety and distrust and all of the things. So it really doesn't matter if you're the grandma or the 22-year-old or the college kid, the dude who's lived under the bridge or the dude who pulled up in his Cadillac. It makes no difference. And that is, I think, the most rewarding thing, is to see people come together, because when you can accept the person across the circle from you, it's a lot easier to accept yourself, which is the goal. That's my favorite part.
Favorite part of my job is Saturday morning. I missed it actually today.
Sorry about that.
That's all right. It's good to be here with you all today too as well. Here's a quick anecdote and a quick story that one of our unsheltered folks who come Saturday morning during Snowmageddon a few years back, or Snowvid, or whatever you call it, the 10 days of extreme cold that we experienced. He was camping out on the front porch of our family ministry center, and I got a phone call and ventured down with the ice on the roads and et cetera to get to him, and we were able to get him into shelter. He probably would not have survived if he had stayed out in the cold. That's how fragile he is physically. And able to get him into temporary shelter, which ended up being 3 weeks in a hotel with 3 meals a day. And after those 3 weeks were over, he came back to Sidewalk Saturday, and I saw him. I'm like, you look fantastic. He's like, I have been living the life. It's been great. Hotel, food, water, bed, shower every day, et cetera. All the things that we could dream of, and heat, right? But one of our parishioners who was serving that day noticed that his shoes were worn and tattered, full of holes. And she knew what size he was. And she went to our clothing closet and got him new socks and new shoes, and knelt down in front of him and took his old shoes off and old socks, washed his feet, and put new socks and shoes on him. And that's the best part of my job, is to watch someone do that for someone else.
Jessie would know this because she knows me well. It's probably easier for me to talk about the worst parts, but because there's
coming.
And what I mean by that is, what I like is when I can eliminate one of the worst parts of my job, because it drives me nuts when I see stupid reasons that people have trouble because of systems that they're trying to navigate. It makes me, I cannot tell you how frustrating that is. And so when something is made simpler for someone who is struggling, and we're able to be part of that and knock out bureaucracy, I find pleasure in that.
The warrior. Okay, favorite, this is my favorite question, because we can't all pretend that everything is great and easy and wonderful and special. So thinking about what's the hardest part of your job. And I also think, I know this is the illustrious panel, literally elevated on a stage, but we are all in community together. And so how can we help you, help your mission, help your organizations? What's the hardest thing? What's the thing that keeps you up at night, but for Jennifer gets her in the morning, in the office in the morning with her battle armor on?
I'll tackle that real quick. I think the beauty of this conference is that we're here together, and we're talking, church, clinicians, faith communities, people, individuals and families who are going through struggles are all here. That is not the case in the real world for most people. We are siloed and separated, and I think there's continues to be a struggle of trust between the different communities and resources that need to work together. And that's the hardest part, is I look at that and say, what has to change to make us come together more so that what we're all doing here is part of a continuum of care. And I think the three of us understand that. Those of us sitting in this audience probably understand that, but all the rest of the folks who aren't here today, do they understand it? And how do we get that message out in a way that pulls us together?
The hardest part of my job is I worry every day, constantly, that we're going to lose the ability to do what we do. I dream it, I sleep it. My staff knows it, although I try to hide it from them. And we're very fortunate. We have a lot of resources, but for how long? So the thing that this audience can do is understand and give voice to the issues that you care about. But also remember, it's not just giving voice. Policy matters. Policy matters. Being active with policy at the local, state, and federal level is really important, because there are reasons that we are not able to be more effective in delivering care that works, and policy matters, and be active citizens.
And in that, I agree completely, learning about the nuances. This industry is so noodly. It's just a big bowl of noodles, and sometimes it's hard to decipher. People will call and they'll say, I need DBT, that's what works. Do you know what it is? I'm like, I do. Why does it work? And they're like, I don't know, and I don't know what it stands for, but I know it works. And so learn. DBT. Yeah, and I'm like, all right, so to the staff, everyone who comes in, we're gonna have DBT day on Wednesdays. Clients are gonna understand what it is, why it works, so they can take it with them. So you're not tethered to a therapist for the rest of your life. If you know it works, you ought to at least know what it stands for and why it works and what the tools are. So I struggle sometimes, because things that we all talk about, and I don't know that we do a really good job of explaining the details. And so research and do your homework and ask questions. If you're looking at a treatment center or one of our programs or anybody's program, ask, who owns this and how does it work? And what do you do? And what does your day look like? And what kind of things do you teach people who come in? And what do you walk away with when you know, and when can you come back? Is there alumni night? Is every day alumni night? How does it work? How do I stay engaged? How do I deepen my community? How do I deepen the experience? What do I do if I want my family member to come in, but my family member doesn't want to be here? Because that's hard too, when the family is working harder than the person that they're working for. So emotionally and personally, watching family members come in and say, my son, my daughter, my brother, my best friend, what do I do? You get them here. Or they have to get here. But in the meantime, the more you know and the more questions you ask, the easier it's going to be for all of us to together bridge those gaps and figure out how to bring our community moving forward.
You have to say what DBT is now.
A dialectical behavior therapy. Marsha Linehan in the 1980s built it upon cognitive behavioral therapy, which is CBT, and people will say, I need CBT, not DBT. Do y'all know how to do that? And I'm like, every counselor ever on the planet for the last 50 years knows how to do that. But nobody knows that. And so you don't know what you don't know, so ask the questions.
And there is a treatment for family members who won't come in or not interested, and it involves actually having the family member come in. So it's a community reinforcement approach, and that's the neat thing about bringing high-quality treatment to San Antonio, like what you're seeing at Blue Heron. Shameless plug.
So thinking about this group here in front of us, what wisdom do you have to share for groups? I know each one of you represents a bunch of things, right? What communities, what workplaces, what friends and family that you represent. So what can you share with them if they want to add to our community of recovery? It's an easy question. Sorry.
It's Stump the Chumps.
That's right. You didn't give these questions to us before.
Wisdom. I have no wisdom. There is no wisdom here. I think I'm really reading that question, Jessie.
How can folks in our community participate in our community of recovery?
You're already doing it, right? Because you're here. I think just find the resilience to keep doing what you're doing and understand and elevate voices that make sense, that matter, care for the people you love. And I know I sound very wishy-washy a little bit for a scientist, but those things really matter. And again, I'll go back to policy and being an engaged citizen because these problems won't go away. We can't wish our ways out of it, and we continue to lose way too many lives to a life-threatening condition when we try to wish our way out of it. Policy matters, evidence-based treatments matter, community matters, and providing rich resources to folks and loving them. And I guess I would also just say, now that I'm thinking of it, it is not the case that loved ones have to hit rock bottom to find a way out. And that scares me all the time, that we let people thinking that that is a necessary condition for recovery, and it is not. Love your kids, love your families, love the people that you care about, and be available to them.
Mm-hmm. That was pretty good. Yeah, that was good.
Bridges to Care San Antonio offers a module called Companionship, which I would highly recommend everyone taking that module. It's free to anyone to take that. And what I think about that is that there are folks who are isolated and alone, and they need a companion. And it's important for us to be trained as to how to be a companion to someone, including our family members, but the extended family and neighbors around us. And so how to walk with somebody through the wilderness that they're going through without taking it on yourself, right? And being a companion along the road. So Bridges to Care San Antonio companionship module.
It's actually being taught right now. So you can get the second part of it after lunch. Well, thank you all so much for being here. I do have a few questions that if you want to group up, we have 20 more minutes. And so I don't know if you're here with your group. I don't know if you're here with your community or if you just want to share with your neighbors. But how can your community be a place of recovery? So I'm gonna let you guys turn. Oh.
I actually, Dr. Mayer, because we work with Northside, so we're educators, and we are very strong supporters of Comfort Cafe. We're already saying we want to knock them to 10. Excellent. Can you talk a little bit in case people don't know the whole basis for Comfort Cafe and knock them to 10?
Comfort Cafe, thank you.
So Comfort Cafe and Naco 210 are tenants at Los Patios. Comfort Cafe is, gosh, I don't know how long they've been around, but at least a decade. And they are not a treatment center. They are a peer-to-peer community. They live in Smithville, and they all live and work there together, and they support one another in coming out of their addictions. And they have homes in their Smithville community. I don't know them very well, but it's great. They have women's homes and men's homes and women with children homes and all sorts of things. And then in exchange for living in their Smithville community, they work in a restaurant that happens to be at Los Patios. And they are so fun. They are so fun. They're open Friday, Saturday, and Sunday, and when you walk in there, it's crazy. Sometimes they're dancing, sometimes there's music, sometimes they're hitting this giant gong and screaming, and you sit down, and the menu is incredible. I don't think there's a healthy thing on the menu, and everything is fantastic. They have the most outrageous, creative foods you could possibly imagine, and it's huge. And they kind of tongue-in-cheek make fun of where we are. My favorite thing on the menu is called the Drunk Monkey. And it's everything you could put in an omelet. You really imagine some monkey in the kitchen just throwing everything in the, it's the Drunk Monkey. And then they make homemade granola, and they put it on their giant martini glass of, so it's so they kind of tongue-in-cheek make fun of what we're doing, which makes it hilariously disarming and wonderful. And the folks who come to the table will tell you, hi, I was a heroin addict for 7 years and I lived under the bridge, and because you're here and because you support Comfort Cafe, I now have XYZ. And it feels good and it's fun, so y'all come visit them. Naco is another good story. They came from Mexico. She's an interior designer, he's a lawyer. They had a food truck that won all sorts of awards in Texas Monthly. It's Mexico City food and northern Mexican interior kind of stuff, and it's really good and totally different. And they're out over the creek, and they have this big, beautiful patio, and they argue over whose grandmother has the best mole recipes, and they'll say, oh, you're vegetarian, no problem. You're vegan, no problem. You're gluten-free, no problem. And so they make everything from scratch, and they serve aguas frescas instead of margaritas. And they do so, they're not in recovery. And they will tell you that they support the idea of a campus that supports recovery, because what Liz always says is, I have kids. And so she wants her kids to be able to come hang out in a place that she doesn't have to worry about anything. So that's part of the health and wellness and community. Thank you for asking about the two of them. They're great. And I will tell you, Naco is my favorite spot on campus because that's where the blue herons live. There is a heron nest right there. And when my husband and I were trying to think of something to call the outpatient treatment center, I promise I'll wrap this up quickly. We were sitting by the creek, and this gigantic heron flew right past us. And they have a wingspan of like 6 feet. They're huge. And we said, well, let's call the treatment center Blue Heron. But then to make sure that the blue heron is not the harbinger of death and doom, we Googled it. And blue heron represents self-determination, evolution of spirit, and independence. And that's why we named the treatment center Blue Heron. So it all kind of connects, and we all work together on that campus, and I thank you for asking.
Can I mention just one thing? I thought of something else I need. What I need are employers that create recovery-friendly workplaces, that hire and give people jobs and create relationships and trust. It is very, very hard to become employed if you have had a substance use disorder, particularly because so much of it unfortunately involves engagement with criminal justice. That in and of itself can be a tremendous fundamental barrier. We'll set aside housing for a moment. Huge issue, and too often people find their only choice is to work in certain industries because people will not hire them. And this is another policy issue, but I really, if there are people here who are employers, lean into the idea, if you don't already because you're in a field like this, figure out a way to hire. There's programs called recovery-friendly workplaces. It is so, so, so important that people have jobs just like we do.
I think we can open it up if anyone else has questions. I think for the panel about this topic of how your place, whatever your place is, can be a place of recovery. Does anyone else have questions? I appreciate you highlighting those businesses.
I have a question. You know, we spend a lot on younger children, and we spend a lot on dementia and older people. I feel like since COVID, I have 2 grandkids. They've lost both their parents. But you know, those 22 and 24-year-olds, I feel that is a very lost area right now. They don't have, like your area that you're at Los Farias, getting them there, that 22 to 30-year-old, a place that's safe, that they want to go. You know, even they say, well, where are we going to go? The bar, I mean, the country western dances, not getting, we used to, when I was younger, we used to go in packs, we would still drink or something, but we would go to drag races, we would go play bowling and stuff. But all that centers now around alcohol or drugs and like the spasmatics. That's wonderful that you have in there. That's a young group, back in the day my daughter worked in there. But I think if I were anywhere as a grandmother helping these middle-aged, I don't know what to call them, young adults, getting place for them, I think we're losing a whole era of children that we're not getting that for them. And it's kind of like they're in the middle. The middle child, not getting as much as the first one and the youngest one. And I feel like, I'm in a nurse for 50-something years. So I work in a big company for more of the elderly and stuff and getting to that community. But so what can we do for them? How can we make Los Farias, how can we get it in the rural community, like the Comal, Green? How can we make in Bernie? How can we get it out there to the in the south side? How can we get more of it there, where it's a place that's local? How can we get it downtown, where you have people that can't make 2 Los Farias? How can we get more of that? And that would be a very big passion of mine, of trying to bring even the health community into that fold of how much they can do. Because I think too, have to reduce the stigma. It can't be where, okay, well, we're going to go to this boring place. How do we get them there?
Right, I agree completely, and I don't know. Really, we started having movie nights on Saturday night. We'd blow up this big 30-foot screen TV, and as soon as it got dark, we'd show a movie. And we haven't quite gotten it right, because either the movie was for little kids and the big kids leave, or the movie is for big kids and it's not quite cool enough, or it's not late enough. I don't know. So we're just throwing darts at a dartboard and trying to see what sticks. And our hope is that it'll catch on. And as we grow, honestly, there are really amazing folks who want to help. Somebody offered to put in a disc golf. I know, we've got a big lawn. Let's have disc golf. That would be so cool. And then people can come hang out and play disc golf on Saturday, but people drink Mike's Hard Liquor when they're playing disc golf, so we've got to have the security there to say, hi, sorry, you're not allowed to bring that in here. to keep it safe for everybody. So we're not there yet, but I think the more we grow and the more we do and the more we talk about it and the more support we have in one community, it's gonna have to pick up, because everybody in here, my guess is, would enjoy having more communities and more opportunities to take their families out without the inherent risks of Uncle Joe and the tequila. So I don't know. But I did get a phone call from a guy in Tennessee, and he said, hey, tell me about this community, this campus that you have. And I don't know how he heard about us. And I asked him what he was doing, and he has a coffee shop, and he kind of does the same thing. And he said he has this coffee shop where the kids who are in treatment can hang out in the coffee shop, and I don't know what a coffee shop really has to do with it, but I was just personally excited that he heard we were doing something. So hopefully the word will get out, and if you have great ideas, I'd love to hear them, and I'm on board, man. Let's go.
So that age group, that 18 to 25, and then that, I just think you've really hit the nail on the head with that. That group in my world is called emerging adults. They're technically called adults, but are they really? And I mean that as no offense to anyone who might be in that age group, but you're still developing. I mean, your brain isn't even, we don't start to deteriorate until about 25. We're still developing up until 25. Neurons are growing and things like that. And so it's a really critical age group to think about. We have a program, the state gave us funds for housing support, and we went back to them and said, okay, that's great to do housing, but can we focus on 18 to 25-year-olds? Because it's just such a critical age, and it can be so devastating on family systems and caregiver systems when there's when addiction is part of the relationship and trying to give them that ability to be autonomous. But I will tell all of us, if that doesn't seem important, because what you said is so important, it's going to get worse. Because of the dynamics of the children that are under 18 right now, and what we've seen not just from COVID, but from a variety of social factors and things like that. So I think that it's going to be a real toll on our culture and on these young people. So I really encourage you to keep doing things like that. And coffee shops are where it's at, Mama. You got to think about that. And thrifting, you need to have a thrift, and so they can thrift.
That's such a complicated age because they're figuring out who they are.
Christine, use the microphone.
I don't know that what I was saying was important enough for a mic, but they're figuring out who they are, you know, when you're in your 20s. It's, am I going here, am I going there? What do people think of me? You know, all of that, and they haven't quite found their feet. So it's the right time to start having them at the coffee shops, the healthier route.
And I want to say one more thing. It's also getting them to church, back into church, and the mixture of both, and to that sense of giving and being with, caring, and it's all of that the mixture, and that's the reason I came today, this week, and yesterday too, is the spiritual mixed with the academic and the city and all the stuff that's going on. How do we bring that together of all the small churches, all the service units in all those churches? That's what I wanted to hear a little bit more about. I just want to say that too, as how do we get smaller churches to be able to put the industry in place of a service? A lot of them want to do something, but they're afraid.
Right.
They don't know how to do it, even if it's just for the grief for the elderly, that have lost a loved one. And how do they put that in place where they don't get in trouble or they're afraid? I feel that's right, because I have a lot of pastors in my family too that are just in it, and that they want to do it, but they're afraid to do it. It's like, I don't know, and I'd love to hear more about, we're thinking when we're talking about this in the future, of how we can bring those smaller churches in and be able to do that bridge for care, that it's reaching them to help individual service in each church. Starting with one little one, not putting all the focus in.
Yeah, so Bridges to Care does reach out to smaller congregations and builds cohorts then around the smaller congregations so they can work together. The college and early career age group, the 18 to 25, sometimes up to 30 years old, is an area I oversee at Christ Church. And so every other Monday night we have that age group at our house. We hang out, watch movies, have discussions, dinner, you name it. And that group has grown from being 6 people to 35. Just because of word of mouth. And some of those folks are now coming to church, but that's not the reason why we created the group. We wanted to create space for people to just be with each other. And so I think the thing I could encourage us to think about is, yeah, coffee shop is awesome, restaurant is awesome, that's great, and I want those things to happen, but at the same time, open up your home to neighborhood adults, young adults who are that age group, and welcome them in and have a fun evening that doesn't always revolve around alcohol and the other things that are happening in our community, and give them a safe place to be themselves and have fun. And it could lead to some great things.
I thought this question about what you can do has got me. So I thought of one more thing. I think too often we separate mental health and substance use when we all know that these things commingle in a lot of cases. I know that it can be difficult if we think that mental health is stigmatizing. Substance use is highly stigmatized, even in the behavioral health community. So the more we can partner with groups that have historically focused on mental health without superseding their mission, and understand how to bring the substance use piece into the conversation, the better off all of the individuals will be. So that would be another thing, is for those of you involved in groups that are historically focused on mental health, welcoming in people who use drugs, who have addiction, or the families who are in recovery, and make a seat at the table for them.
I had a thought also. People who are in their 20s, they probably know that we're all in here talking about them. Some of you were here, I'm thankful. I'm sorry, sister. My sister's celebrating her 25th birthday next week, and so we're thankful she's crossing into the age where her brain will start decaying and stop growing. Thank you, Dr. Potter. So, working on behalf of, or thinking about, or loving people that are the younger people, the youth, the children, the emerging adults, the 20s, whatever they are. They have to lead in this space, and we have to allow them to lead in this space. And I'm a person of faith who's pretty involved in my church here in San Antonio, and I work in this space. And so in both places, whether it's your family, your community, your church, your school, they have got to be the ones leading out in this. And that's part of the hope I have. There's a statistic that people will on average wait 8 to 10 years to get help for their mental health, and that is not going to be the case with the younger, I hate saying younger, with the people who are coming up today. They are demanding it, and when we create events or systems or programs for them without their input, it's just gonna fall flat. And so remembering that they're totally way more informed. Look up mental health TikTok. They know everything, and I'm being serious. These are folks who have had the internet and all of the knowledge that anyone could possibly have for their entire lives. And so they don't need to be told anything. They need to be asked to lead. They need to be given space. They need to be held accountable and responsible. They need to be asked to provide food at Thanksgiving dinner because they're grown-ups. They're gonna bring the green bean casserole or whatever it is. And so this is something that I appreciate your passion, and I have it as well. But we've got to allow them and elevate them and empower them to lead in this space and see what happens in a little bit. And I'm not saying you would ever be in their way, but I have to get out of the way of what they're able to do and accomplish and lead in their own space. They have all the knowledge. They need the ability and power to lead.
I love how you added the piece to let them be a part of that leadership, because all the things that I've been reading lately, especially with that group that you mentioned, the reason sometimes we can't, I'm a faith community leader, but one of the reasons we can't get that age group to come back to church or to go to church is because they're tired of hearing about Jesus. They want to see Jesus in us. And as adults, sometimes what we do is condemn and just correct, and you're wrong, and talk down to them. They need to be brought to the table, whether it's a part of their leadership team, to get their input. But secondly, I just want to encourage you to start talking to people in your community, because these ministries, programs help started because somebody like you started asking questions and seeing the need. And people are going to come on board because we need it. Our young adults need that. So I just encourage you to go out and do it, because you're going to have people behind you. And I encourage anyone who is a faith person and goes to your church to begin to see our young adults and even our kids as part of our team, see and get their perspective. One of the things we began doing at our church on Sundays before we go home, we're bringing our little ones and our teenagers and young adults to pray over their mental health and over their petitions, because even if we don't know it, those little kids have anxiety and have things that they're facing that to us it's nothing, but to them it's life, and it's life that they have to be living every day. But anyway, I just want to encourage you to go out and start talking to people and start something, and encouraging the adults for us to stop being condemning and just always giving the right advice, and just start letting them see Jesus in us and allow them to bring their thoughts to the table. Thank you.
Can I just give a shout out super quick on your side? I am so proud of our department and my director, because we have what is called Second Chance Academy. And so those students that come for the first time for a felony substance, rock and dab, liquid THC, they don't go to alternative school. They go to Second Chance Academy, and it's all about recovery, building them up, giving them tools, as well as their education. And I would love to see more education or doing things around that, because substance abuse with our kids is out of control.
So let me ask, is your question quick?
Well, I just want to add, I'm also an educator for SAISD, and I work with students as a high school math teacher with a leadership academy. And if there is a bit of advice, I just got here today because my Aunt Betsy brought me.
She's a leader.
And we're working on trying to see what we can bring to our campus. What bit of advice would you give an educator to discuss with the counselor, anything that NAMI could provide, that maybe how you would maybe potentially interface with the community as well?
Yeah, let me give a quick answer to that. So I don't work for NAMI, but the NAMI, one of the benefits of NAMI is that as a national organization, they have really excellent educational materials that are like branded and look good and easily print outable and hang upable and hand outable. So I would explore the NAMI website. One thing that I have learned about the teacher, and I used to be a teacher myself, you oftentimes are the least informed on what's going on in your campus and your district. And I'm working on it. I've got lots of programs with communities and schools, with the Mobile Mental Wellness Collaborative, but you ask your questions, ask your counselors so that you can see the student. You're front line, you're with them all day, and you can help them better connect. Because there is excellent things happening in SAISD. I went to your student advisory committee meeting. It was all about mental health and with Dr. Aquino and everything. And so there is things going on, but I think the teachers have so much other stuff on your plate that you're just unaware of what's going on. And that's so unfortunate that you're the actually ones seeing the students all day long. And so there's great stuff happening at SAISD. Ask the questions and become that mental health ambassador with your other teachers and help them along, because I know you guys have so much that you have. We need to wrap up. We're 5 minutes over. I'm gonna ask these folks to miss their lunch. No, to stay here and answer questions. I wanna tell you that this is the best part of my job. Being on the verge of tears for, 3 hours now, getting to hear so many amazing stories and elevate community partners is the best thing I get to do. And thank you so much for bringing up Second Chance. Let's all be people of recovery, let's all be people who support recovery, and let's be a people of the second chance. And thank you all. Have a wonderful lunch.